Hello and welcome to the Harvard Street Neighborhood Health Center's The Power of Health virtual gala event. My name is Yadires Nova-Salcedo and I will be your Mistress of Ceremonies this evening. And let me tell you, we have such a great program in store for you tonight. First of all, we are so excited to have you. We hope you've enjoyed that beautiful performance by the Athene Wilson and Friends Band, a wonderful way to start off the night, and they will be continuing to grace us with some beautiful music throughout this evening. Before we begin, we want to acknowledge that a virtual gala will be different from what we're used to, and the way we connect during it will also be very different. We have lived through so many unprecedented challenges this year. We have struggled through the pandemic and the political and social unrest at hand, and we have definitely felt the division and need for leadership throughout the country. But we have also seen communities rise up to help their own. We've seen how much impact one person can make and how important it is to bolster community groups that are making a difference. This is what makes tonight even more important as we honor three special leaders in our communities who are fighting for health equity, fair research, and financial literacy and education for all people, especially those who have historically been marginalized. Harvard Street Neighborhood Health Center has been on the front lines of community health for over 50 years, and with your help, will continue to be for a long time to come. So go ahead, gather your family and friends, pour your beverage of choice, and settle in. Without further ado, please welcome our board chair, Bonnie Brathwaite.
Welcome, one and all, to Harvard Street first virtual gala, The Power of Health. My name is Bonnie Brathwaite, and I am the proud board chair for the Harvard Street Neighborhood Health Center. Tonight, we will celebrate three outstanding leaders from our communities, reflect on the past year at Harvard Street, and share our hopes for the next. I am so proud of our accomplishments this past year. We have learned into the challenge of a global pandemic, forged ahead to provide quality healthcare in our communities, and even as the numbers continue to grow exponentially, Harvard Street maintains a level of safety and commitment that is incredibly inspiring. Tonight, I want to thank everyone from our frontline workers and staff to our CEO. The Harvard Street community has flourished, and it is because of each of its members. I also want to thank our patients for putting their trust in us. It is a true honor to be able to take care of you. I also want to give a special thank to our staff. You are the pulse of Harvard Street, and without you, we could not do the important work of caring for thousands of patients and a deserving community. I am excited for tonight's event and to move forward into a new chapter in Harvard Street's life. We are moving forward with our vision of a new building, a new healthcare center, and it's only be possible with your support. A new healthcare center will let us have a greater impact in our community, both treatment and employment-wise. Harvard Street is one of the largest employers in the Dorchester area and is integral to the economic vitality of the community. Our dream is to expand our healthcare center into a new building where we will augment our services and programs. We also hope to redevelop our current building into a mixed-use arena, including units of affordable housing, expansion of our healthcare programs, and commercial space that is viable for community members. Our expansions mean that more patients have access to good healthcare, and we will provide more good jobs with more community members having the opportunity to put food on their table for their family. I again want to thank our generous partners, donors, and members. We could not do this without you. It now gives me great pleasure to introduce our fearless leader, President and CEO of Harvard Street, Mr. Stan
Good evening, everyone. My name is Stan McLaren. I'm President and CEO of Harvard Street Neighborhood Health Center. And thank you, Bonnie, for that introduction. And thank you all for joining us tonight for our annual fundraising gala, albeit virtually. We have chosen the power of health as a theme because of the importance of health and healthcare in everyone's life. We've seen the importance of healthcare even more this past year as this pandemic rages throughout the nation and rages in our community. This crisis has caused unprecedented strains in the healthcare delivery system. We've acutely felt the shortage of PPE and testing supplies, those supplies that are vital to treat, diagnose, and protect. From the onset of this crisis, Harvard Street has been on the front lines caring for our communities. We witness firsthand how this virus is exposing endemic inequalities that have too long been ignored. Multiple factors are at the heart of these disparities. Social determinants of health like poverty, systemic oppression, or lack of access to nutritious foods or quality housing have all negatively impacted the outcomes of the people we serve. But even worse, for those that have been stricken by this disease. How has Harvard Street responded to these new needs? Our clinicians and staff have selflessly and courageously worked to provide care to our patients. We've worked hard to maintain the programs we have always provided, but at safety levels that conform to our current pandemic standards. We increased our food pantry capacity. We started contact tracing and convenient mobile testing for the virus. To date, we've tested thousands of people in our community. Moreover, our vision for the future of Harvard Street not only increases access to high-quality healthcare, but also addresses the many inequities laid bare by this pandemic. Our expansion plan adds hundreds of jobs, creates affordable housing, and provides an economic anchor that would lead to the revitalization of this community. Our expansion project would be a national model that demonstrates how to reduce disparities in health while improving economic outcomes. So I ask for your support as we continue our capital campaign to expand our healthcare center. Your support is vital to our continued growth and success, and for us to be able to meet the increasing needs of the Boston community. Throughout the night, we'll have different opportunities for you to contribute monetarily. And I want you to contribute a lot to this vision of ours. Stay tuned for the ways you can do that. Again, I want to thank you for tuning in tonight. It's going to be a lot of fun. We've got some good things planned for you, and I hope you enjoy. And by all means, and all day long, God bless. Thank you.
You're broken down and tired, living life on a merry-go-round. You can't fight the fire. I see you gonna walk out and mountain. We're gonna walk it out and mountain.
Our first honoree is Robert Coughlin. He's the president and CEO of the Massachusetts Biotechnology Council and has worked to improve patient lives, grow the healthcare science industry, and increase health access to patients who have traditionally been marginalized. Bob is being honored tonight for his vision to create the 2.0 CEO Pledge for a commitment to make the science and health industries more inclusive. To date, the pledge has been signed by more than 200 CEOs. This is truly unprecedented and needed in this industry. Congratulations, Robert Coughlin.
Good evening to everybody. I'm honored to receive this award and to be here with both Pam Everhart and Dr. Ted Love. Congratulations to you both. It's an honor for me to share this virtual stage with you this evening. I've long admired the work of the Harvard Street Neighborhood Health Center and its commitment to putting the patient at the center of everything that you do. It was many years ago that board member, my dear friend Brian Shelley, introduced me to the organization, and I had the privilege of meeting with Stan McLaren and learning so much what you plan on doing in the future. And not only do you provide comprehensive healthcare services to underserved populations in the Dorchester area of Boston, but you think about how to heal the whole person, including food services and mental health services. Even more, you're the only health center in Boston that runs a full-service veteran center, which is a major need in our country right now. COVID has put a spotlight on the health inequities in our country, and it's organizations like Harvard Street that are making healthcare accessible to everyone, no matter their background. You know, I personally know how important it is to provide compassionate healthcare because I have a son who has cystic fibrosis. And it's the nurses and the doctors and the complete healthcare team that make all the difference in making us feel as though he is receiving the best care possible. So when healthcare providers engage with patients on a personal level, they can dig into the root cause of a health problem, which we know is the key to creating lasting change for a patient. You know, we need more providers like Harvard Street who have a dedicated, diverse team of professionals who are compassionate about the care that they provide to patients. So it's an honor for me to be here with all of you tonight, celebrating the power of health. I want to thank Harvard Street and the entire team and all the amazing people who go to work there every day to make the community a better and healthier place for all. Thank you so much.
Congratulations once again, Bob. Our next honoree is Pamela Everhart. She is the Senior Vice President and Head of Regional Public Affairs and Community Relations at Fidelity Investments. Pamela has led the company's efforts to create financial literacy in scores of students from underserved communities. Pamela has also been appointed by Massachusetts Governor Charlie Baker and Boston Mayor Marty Walsh to address racial inequity and systemic issues in the Commonwealth. Pamela is being honored tonight for her outstanding work in these areas. Congratulations, Pamela.
Good evening. Congratulations to my fellow honorees, Bob Coughlin and Dr. Ted Love. I'm happy and honored and humbled to be among such exceptional and phenomenal honorees. And Harvard Street, a leader in community healthcare services, thank you for this special award. It is with pride and appreciation that I accept it. This award means a great deal to me because my husband Carl and a couple of my longtime friends, Gail Jackson Blunt and Joanne Thompson, were board members of Harvard Street years ago. And they spend time only on initiatives focused on making a difference in the lives of others. However, what's more meaningful is the quality healthcare Harvard Street provides in the Dorchester community. I'm a resident of Dorchester, and I know firsthand that Harvard Street's dedicated staff helps make access to quality care possible in my community. They deliver support to some of the most vulnerable, and they make an enormous difference in someone's life every day. Lives are transformed by the incredible work of the healthcare professionals and their staff at Harvard Street. Quality healthcare is a right for all people. There is no question that our country must work harder to combat health inequities. And COVID-19 is amplifying the need to accelerate the work. Harvard Street is making meaningful steps toward addressing health inequities in our communities of color, and its work could not be more critical than in this moment. I believe our lives are limited and lifted by what we believe is important. If you believe the mission and work of the Harvard Street Neighborhood Health Center is important, then join us as we support their work and you do your part to drive positive health outcomes and improve health inequities in underserved communities. Thank you.
Congratulations once again to Pamela Everhart. Our next honoree is Dr. Ted Love. He is the president and CEO of Global Blood Therapeutics, a California-based research company that developed the first sickle cell medicine treatment approved by the FDA to target the underlying causes of this disease. Dr. Love is being honored tonight for developing the Oxbryta treatment, which will improve the lives of millions throughout the world. Great work, Dr. Love.
I want to thank the Harvard Street Neighborhood Health Center for not only this award, but more importantly, for the work that you do in the community. I'd also like to extend my congratulations to Pamela Everhart and Bob Coughlin for the work they've done and continue to do to make positive impact on innovation. For those of you who don't know, GBT's mission is to bring life-changing treatments to people living with grievous blood-based disorders, and we started with sickle cell disease. Sickle cell disease is a devastating disease which has ripple effects across the patients and the families, resulting in approximately 3 decades of reduced life expectancy. I personally first encountered sickle cell disease when I was a medical student at Yale, and then in Boston during my residency at the Mass General. Despite the long established impact of this disease, innovation and investment were neglected for decades, in large part because it primarily affects individuals of color. As a Black physician, I was embarrassed and angry at how the patients were treated in the system, in the healthcare system. I would often see patients come to the hospital with excruciating pain, only to be treated as drug seekers, stigmatized. From the beginning, GBT's vision has been to improve the lives of those with sickle cell disease using scientific innovation, and we've approached this with a real desire on the person. It's personal for me. We are incredibly proud that our first medicine, Oxbryta, was approved by the FDA just last November. This was a big milestone for our company, but we think most importantly for the sickle cell community. This milestone would not have been possible without the partnership of the community, including organizations like Harvard Street, which are so invaluable to these communities. So I accept this award on behalf of the more than 100,000 patients in the US with sickle cell disease. Thank you again.
Congratulations once again to all of our honorees. It is so inspiring to hear from individuals who have taken their passions and gifts to make a positive impact in their communities. A big thank you to the honorees for their contributions and for being here tonight to share it with us. At the end of the day, all of us in community work have the same goal, helping the individuals who need it most. We will now hear from a patient at Harvard Street whose family and community have benefited from the multitude of services provided by the health center.
So you guys did a lot for Haitian people. Not only for us, but for all American. American or not American, no matter what you are, no matter what nations you belong to, Harvard Street always there for everybody. My gum, I came in here, I was suffering and going crazy. They said right away it's an infection, it's very bad. And then, bingo. They called the doctor, they said this is important. I understand that she didn't have an appointment, but please try to do the best because it's not a joke. And then the first one saw me, The second one said, oh my God, you have to take antibiotic right now for 1 week, 3 times a day. Then you come back to see if things get better. I was going to go away in Haiti. That's where I was going. They told me not to travel because the infection is too bad. I'm not going to make it. I have to make sure to get it clear up first, take medication, come back to check it, and then I will have the okay for now. This is not a joke. Save somebody's life. And when you know you have high blood pressure, you have high cholesterol, you have diabetes, this is not a joke. They're always there for you no matter what. This is important. Harvard Neighborhood Health Center. That's the best. Keep it up.
Good evening. I hope you've enjoyed the program so far. My name is Brian Shelley, and I'm the Board Vice Chair here at Harvard Street. I want to thank everyone who has put such a great event together for us tonight. We've come together tonight to celebrate our honorees and to reflect on Harvard Street's accomplishments over the last year. We've been able to do so much because of your support. We launched our COVID-19 mobile testing program, testing thousands of patients while providing a safe and socially distant testing environment. We continued our women, infants, and children nutrition program that safeguards the health of low-income families in Boston. Our dental office invested in a new, state-of-the-art mobile air filtration system, which reduced the hazards to patients and the dental team and protected them from aerosol air droplets. We kept going despite the challenges we faced. As we continue through these times, we will face more obstacles. Funding is one of them. We hope to not only maintain our clinic, but also to grow our capacity, services, and programs in order to make healthcare accessible to many more people. Your support can help us do that. Your support helps to pay for clinicians, programming, training, and clinic space, among many other things. Your support helps us to provide PPE to those who need it, and to upgrade our technology to maintain quality patient care. Your support makes a difference in your community. To donate now, head over to gala.harvardstreet.org or to our website, www.harvardstreet.org, and click on the Gala page icon or the donation button. We also want to thank our sponsors and those who have already given.
Decir adiós. con calma, besa, besa, besa con toda la plata. Quiero amanecer contigo todas las mañanas, así que besa, besa, bésame. Cógeme tu cuerpo una y otra vez. Dame tus caricias, hazme enloquecer. Quiero estar contigo hasta el amanecer, así que besa, besa, bésame. Havana, 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 pero qué rico, déjame escucharte. Havana, let me hear you. Havana, let's go to Havana, me Havana. Ay, Havana, 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 qué rico, mi Havana. Havana, bésame, bebé. Havana, contigo quiero amanecer.
Wow, that was beautiful. Thank you so much, Athene, for sharing your gift with all of us tonight. So many people have worked to put a great event together for us, and in my opinion, we're about to begin one of the most interesting parts of the evening. Dr. Chris Lathan, a friend of Harvard Street's, is the Director for Cancer Care Equity Programs at Dana-Farber Cancer Institute. He specializes in race, class, and access to care in cancer outcomes. Dr. Lathan will now lead a conversation with our three honorees focusing on their individual passions and the work they're doing to address overall health, including science and economic disparities in our communities.
Your zip code, your income, your skin color, the language you speak should not determine the quality of your care. And that brings me to the next questions for you guys is really talk about community and defining community as to what it means for you all. And I think we're going to go in reverse order, Bob. I know you just spoke, so we're going to hit you again and talk about community, and then we're going to go back, and then we'll go to Pamela. So tell me what community means to you, especially in the context of this, talking about equity and
Yeah, and something, it's all about community, right? And when I think of personally, right, and what has given me the outlook that I have on life, if I didn't have the cystic fibrosis community early on and my son's diagnosis, I probably would have been curled up in the fetal position, depressed somewhere, or drowning my sorrows with alcohol or something. If I didn't have those people to help lift me up when I was down, I wouldn't be where I am today. So when you think of, to me, the community was folks from the cystic fibrosis community, folks from Boston Children's Hospital, the medical community, the scientific community, the philanthropic community, people like Joe O'Donnell, who lost his son to cystic fibrosis, that came to me and said, let's go raise money and invest in research so that your kid doesn't die like my kid did. So community to me is everybody taking care of each other. It's not about us doing better than them or this or that. It's about everyone, because we're only as good as that lowest common denominator. And going back to saying, when I was in elective office, what would drive me nuts would be to think that my kid could get better care than someone else's kid. Not cool, not good. So for me, it's about community, and it's about people taking care of each other, people caring about each other. It's about civility. Couldn't we use more of that in our world right now? Well, that's what community is all about. Community is a wonderful word. It's a powerful thing, and it's so important for all of us to do better together as a community.
Thanks, Bob. That's great, right? Community versus exclusion, right? We want to, kind of move towards that. So we go to Pamela Everhart, and in that same question, tell me about community and what community means to you.
Well, for me, because I focus a lot on the kids, that's the first place I go to, because I think going back when I grew up and being uncomfortable with finances, I didn't grow up where we were talking about stocks and bonds or even Bitcoin right around the dinner table. And I was a little hesitant when people would start talking about it. And actually, my first job, I was even afraid to invest in the 401k. Because I'm not sure what this is all about. I didn't understand saving versus investing. My mom, when we were kids, she was so good, like a lot of Black moms, they are the CFOs of their families. So they're really good about saving. They can make, a penny go a long way. But what she wasn't good was in investing, in helping her, making her money work for her. So my community has really been about seeking out underserved schools in the Boston area and making sure that those kids learn. And just one quick story. I was doing some financial literacy training at a school in Roxbury, Orchard Gardens, and there was a little boy by the name of Marlon, 12 years old, went through the program. And at the very end of the program, he says, "I'm so excited." And I said, "Why are you excited, Marlon?" He said, "My mom just got a job. The first time in my life that she's gotten a job." And I'm like, "That's great." And he said, "I took her down to the bank so she could open up a checking and a savings account," because she had never done that before. And then I told her, I said, "Mom, when you start on your job, the very first thing you need to do is ask about their 401k so that she could start saving." So for me, just these kids, getting them when they're young can make a difference in their families. And that's what I'm hoping to accomplish.
That's fantastic. And I just want to add, my mom, as you point out, is definitely the CFO of the family. Me and my brother and my sister would always say, Mom would give you her last dollar. And that's true. But unfortunately, it really was her last dollar. And I think, we didn't learn, and that, we were lucky enough to, even when you're lucky enough to go get education, you didn't learn how to manage your money because my mother never knew and her mother never knew. And so I wish we had your class then, and I hope further generations will be able to take that. Heck, I might come in and drop in myself just to get some pointers.
You're welcome.
And so, Dr. Ted Love, also coming back to that community question, tell me what community means to you?
Well, first of all, I do want to acknowledge what Pam said. Pam, I think you knew my mother in terms of being able to stretch a penny so far. But there was no concept of investing in our family. And I really do wish that my parents had the benefit of knowing someone like you and what you're doing at Fidelity. That's so important. Chris, for me, community is all about coming together to achieve something much greater than we would achieve as individuals. In fact, if you read Socrates, one of the things that you recognize is the whole benefit of a civilized society is to come together and not focus on yourself, but focus on everyone else. And by doing that, we all benefit extraordinarily. And so community for me is really about us coming together, whether it be a sickle cell community, whether it be an African American community, or whether it be us as a United States community. We should really be coming together to help each other, and by doing so, we will all be extraordinarily more successful.
if you could, pick one or two things you'd like to focus on in the future that would improve life for poor communities, specifically Black and brown folks throughout the U.S.
Yeah, I will be quick and give you one. I talked earlier about supporting nonprofit organizations. The other thing that I think we need to do is to support Black and brown businesses. And one thing that we're going to do at Fidelity is double our diversity spend in the Black and brown communities, because support of these businesses is even more important during these times. So that's what I would challenge everyone to do. Support your Black businesses.
Well said. Dr. Love.
Similar. I would focus on equity. This country has dug itself an enormous hole, and some people are trying to dig the hole even deeper. But the way that this country is going to be tremendously strong and achieve its great potential is being equitable. Because when you're equitable, you get the best outcomes for everyone, and you get the strongest nation overall. So I'm very focused on equity, whether it be in education, whether it be in jobs and opportunities. We've just got to make our society more together and more focused on equity for all.
All right, Bob, you get one last line in here.
Yeah, I want to talk about the workforce piece and creating an on-ramp for first-generation college students from underserved communities so that they can get the summer intern jobs at all these amazing, we represent 1,400 life science companies here in Massachusetts right now. Let's continue to build off of Project On-Ramp, which we started with Life Science Cares, Massachusetts Life Science Center, MassBio Ed, and MassBio got together and got our member companies to offer up these summer internships, partnered with Bottom Line, and we're plugging young adults, amazing students that never would have known what the life sciences industry was if we didn't create this on-ramp. I think that's a great way to promote equity, diversity, and inclusion, and also give us that pipeline of workers of the future that we need to stay on top of.
Well, thank you. And again, this is not enough time, but I do want to say, first of all, thank you very much to our awardees. As you can hear, everybody's doing tremendous work. And I just want to say it's an honor to just be a part of this panel and to talk to you all. And I would love to follow up at some other time. I also want to thank not just our panel, but all the sponsors who made this possible. And we look forward to these, not just conversations, but action and accountability going forward, right, in all of our actions in the future. So thank you very much for your time, and we're looking forward to the plans to make things better, more equitable, and certainly more reach for those poor, vulnerable patient populations.
So we started dealing with the COVID pandemic very early. I mean, even before the end of January, we were talking internally in senior management about the potential risks involved, and began by the beginning of February having it part of our discussions in all staff meetings and preparing staff about what we knew and didn't know, but that, this was something to be concerned about. And as we moved into March and things really started heating up, I think we were well prepared. We began testing the same week the test became available through our laboratory. And, within 2 weeks, we were having positive tests among patients that we were seeing here in the clinic. Very rapidly, we moved to moving most of the staff to working from homes for the safety of patients, for the safety of staff, to be doing telehealth so that, that created the safest environment for everyone. At the same time, we continued to have a pediatric and adult provider and OB here if there was a need for someone to be seen face to face. I think as we move forward, we're back to providing all the services that we usually do here. We're continuing to do some proportion of telehealth and inpatient visits. We're continuing to prepare for the possibility that, we may be dealing with another serious wave this winter. I think there's additional challenges that we're facing, thinking about as cold and flu season comes and COVID, and how do we provide care for people who need to be seen because they're sick, whether that's with COVID or something else like influenza. So yeah, I think throughout we've been trying to adjust to changing circumstances. I think we've been right there on the cusp of providing what we can to give people the care they need and to keep people safe.
Thank you so much for staying with us. We hope you've enjoyed this great conversation and were able to get some great ideas and are now inspired to take action in your own lives and organizations. The health of our patients and community members is what drives us at Harvard Street. Our vision is to make things better. Would you support Harvard Street and our mission tonight? By doing so, you're helping us fight health inequity, provide health education, and provide a healing space in our community. Because of generous donations from people like you, we have been able to continue meeting the increasing needs of our community by providing food to needy families and being able to cover insurance for uninsured individuals throughout the year. Today, your support is even more essential. To donate now, head on over to gala.harvardstreet.org or to our website, harvardstreet.org, and click on the Gala page icon or the donation button. And remember, any amount makes a difference. No amount is too large or too small. To our sponsors and to those of you who have already donated, thank you.
Congratulations to Harvard Street Health Center doing and keeping the community safe for so many years. Congratulations on your night. Before I go, I'd like to introduce the band. We have Mr. Rollins Ross on keyboard. We have Mr. Daniel Day on bass. And on congas and percussion, Sada Cola. With something happy, something for you to think about. All right. Listen. Good morning, evening, friend. Here's your friendly announcer. I've got some serious news to pass on.
thank you, Athene. What a powerful song. And thank you all for tuning in tonight to celebrate the Harvard Street Power of Health virtual gala event honoring Bob Coughlin, Pamela Everhart, and Dr. Ted Love. Thanks to Dr. Chris Lathan and our hardworking staff, and a heartfelt thank you to our wonderful sponsors. We will continue to update you on our latest developments, including progress on our brand new state-of-the-art health center. I'm Yadires Nova-Salcedo, and I want to thank you all for joining us tonight. Stay healthy, and we'll see you next year, hopefully in person. Have a great evening.
la.